Oh. Who's that, Brandon? Richard, if you want to just do a quick test to make sure they can hear you.
Can you guys all hear me? Just put your, okay, thank you. Okay, we're ready to go. Okay, welcome everyone, and welcome to our viewing audience as well. Mayor Stively's away on a well-deserved vacation, and I will be chairing the meeting this afternoon. So I'll call the meeting to order and ask if there's any declarations of conflict of interest. And I see none. If you have one at a later point in time, just let us know. Looking for the adoption of the published agenda for this afternoon's meeting, special meeting. Moved by Councillor Bjorkman and supported by Councillor Verbeek. All in favor? That's carried. Thank you. We have a report that we're going to discuss this afternoon, Human Resources Report 2021-02, which is the Town of Essex vaccination policy. And at this time, I'd like to pass the mic over to our CAO, Doug Sweet.
Thank you, Deputy Mayor. Good afternoon, Council. At the last regular Council meeting on Monday, October 4th, Administration presented a staff mandatory vaccination policy for Council's approval and endorsement. At the conclusion of that Council meeting, Council directed Administration to schedule a special meeting just for this topic. The intent of tonight's meeting is for Administration to bring the proposed staff vaccination policy back to Council, and at the conclusion of the meeting, Administration will be looking for Council to provide direction on the policy. Administration will then bring back the policy to the next regular Council meeting on Monday, October 18th, for final approval. As a brief recap, the Town of Essex will be the last local municipality to bring a staff vaccination report to the, and Administration's recommendations are similar to several of our surrounding municipalities. The Town of Essex is committed to providing a safe working environment for our staff, and the town has a legislated obligation and responsibility to take every precaution reasonable for the protection and health and safety of our workers. The purpose of the staff COVID-19 vaccination policy is to confirm the expectations and requirements of staff with respect to COVID-19 and vaccinations. This policy be amended from time to time to ensure it is current with the Ministry of Health and local public health unit guidelines on vaccinations and boosters for COVID-19. During the October 4th meeting, Council had questions or comments that Administration would like to address prior to tonight's Council discussion. So I'm going to go through a few questions that we feel were asked and kind of responses to that. Is this policy for public and staff? This is a staff-only policy. Note that normal practice for developing and improving staff policies, including health and safety policies, is not to go to Council for approval, as these are operational policies. However, for this policy, Administration felt it was important to bring this policy to Council, as if some staff chose not to get vaccinated or tested, it could have an impact on service delivery. Second question, is it mandated by the province or local health unit that the town must have a staff vaccination policy? Simple answer is no. However, the provincial chief medical officer and the local health unit have recommended employers develop a vaccination policy. Currently, it is mandated by the province that any member of the public entering a town recreation facility who are 12 years or older must show proof of double vaccination. Without a town staff policy, you could have town staff who are not vaccinated or have proof of testing, checking the status of the public coming into our recreational facilities. Third question, how many staff are currently vaccinated? The town has approximately 207 staff who this policy would affect. Administration did send out a voluntary staff survey a month ago and did receive approximately 50% of the surveys back. Out of the surveys returned, over 90% were double vaccinated, but as the survey was voluntary, Administration is not aware of the remaining 50% status. Next question, can staff who are not vaccinated be accommodated and work from home? Staff work accommodations are based on injury, medical, or accessible reasons only. Accommodations are not granted based on a staff not agreeing with a policy. However, administration did conduct a review on how many staff could work from home. With town facilities open to the public and reviewing the requirements of their jobs, out of the 207 staff positions, at a maximum, there could be 18 staff who could potentially work from home. This includes union and non-union positions, but also note out of these 18, the majority of those did respond to the voluntary survey and they would not require accommodations. Would staff be terminated if not vaccinated? As stated at the October 4th meeting, the intent of this policy is not to terminate any staff. And with the options administration provided, we do not see where there would be any terminations. Administration is aware of other public agencies and other municipalities who have policies that if staff are not vaccinated, they would be terminated, but that is not the intent of this policy. Why do staff who choose not to be vaccinated have to pay for twice-a-week testing? As this is a staff policy, if a staff chose to select an option where there is a cost, administration feels this cost should be borne by the staff and not the taxpayer. Administration has put a lot of hours in developing this policy, and we continue to look at ways to protect all staff and the public, but also provide options to our staff. After the last council meeting, there seemed to be some consensus on a few items. Administration has reviewed these items and have looked at options to work with our staff and council. So if any that were available, to look at the 4 options that were raised. 4 items we looked at more: education program for all staff, not just the staff who are not vaccinated. Look at providing timelines when the policy should be reviewed with administration and council to amend to current restrictions. There were concerns on wording that staff would be terminated if not vaccinated or refused testing. And we looked at how to reduce or maximize a twice-a-week test costing to employees who chose this option. So based on those 4 points, I'll now turn it over to Brandy Seidman, our Manager of Human Resources, to speak further on each of those items.
Thank you, Doug. So as the CEO mentioned, we did look at those 4 items that seemed to be consensus, in our last meeting from council. So the first one, the education program, for all staff and not just for those unvaccinated. Although the educational component is really aimed at those who are unvaccinated, we do see benefits in providing that training to all of our staff. This could be administered through the town's current online health and safety training portal, DUNC. Not all committee members have access to that portal, so we would still have options of virtual training as well as paper copies of that training in the testing for those that don't have internet access. In terms of the timelines, when the policy should be reviewed by administration and by council. Following last meeting, I think it was all agreed upon that we could formally put that into the policy, that 3-month period where we would review that policy, and that way it gains that transparency, and that the policy would be reviewed. I know there were some concerns on the wording that we put in there, that there may be disciplinary up to and including termination if not vaccinated and refuse testing. Again, recommendation would be to remove the word termination. So specifically that would be in section 4.2, number 7. So it currently reads, the staff member is on unpaid leave and may be subject to disciplinary action up to and including termination. So that line would be converted to just may be subject to disciplinary action. So we remove that word termination altogether so that we ensure that our intent of not terminating really is worded in that way. And then the last one was, how do we look at minimizing the twice-a-week testing cost to employees who opt to not be vaccinated? And so we looked at a couple of options here. The first one we looked at was our extended health benefits. Is there anything that we're currently covered for that might be able to cover some of those costs? And so we looked at our coverage, and unfortunately, there is nothing today that would allow for that, that testing to be covered under one of our extended health programs. And so the other option that we looked at was whether or not our nurse practitioner, Catherine McPherson, would be able to administer those tests and then be able to look to see if there's any provincial or federal testing initiatives that would either reduce or eliminate the cost to employees. At this time, there's a couple of options. There's the Leamington Chamber of Commerce, as well as Windsor Essex Chamber of Commerce, who do have rapid antigen screening programs that are free of charge if their employer is 150 employees or less. They do make it very clear that they are only for employees. And so in terms of those members of council or committees of council, they would not be eligible to use that testing. The solution for that we still continue to run most of those meetings either hybrid or virtually, and therefore those members could still participate in meetings. They just wouldn't be able to come to a town facility unless they were to pay for a testing at a pharmacy within 48 hours of attending town property or town facility. So those are the four that we felt, seemed to come up and we wanted to address. And with that, I'll hand it back over to the mayor.
Sabine, HR manager. And now I'll open it up to council for any questions, further questions. Councillor Verbeek.
Thanks. Through you, Mr. Chair. I just, I know everybody is going to have lots of comments, but I just had to jump on this and say, Mr. Sweet and Brandy and team, it's very clear to me that you were listening to us all at the last meeting and hearing our concerns and comments. You seem to have addressed most of them, all of them that came up that I can think of. And I really appreciate that. And the things that I had my biggest concern about, and that I did have conversations with a few of, town employees, were the costs. And you certainly have found found a great way to get around that. And the termination piece was a little bit harsh for me. And so I for one, I felt bad when I left that meeting because I thought, it's very clear you have put a lot of work into this, but we need you to tweak this. And it's clear that you listened to us. And so I appreciate that. And I'll be supporting it.
Councillor Bjorkman.
Thank you, through you, Mr. Chair. Again, to Ms. Sieben and to Mr. Sweet, thank you very much for taking all of our thoughts and stuff into consideration and really going out and answering, not just answering the questions, but finding solutions to a number of things here. I want to go back to just a statement and a statement that was made by Councillor Bondi, and I agree with that. This is the reason we're having to do this is a lack of leadership from the province. I don't know how this ever became our responsibility to come up with these plans that should be uniform throughout the province and for municipalities, 4 levels of government. But we do need to ensure that our workers have a safe workplace. And you've gone out and done the work to make sure that we have a safe workplace and that everyone can attend. So those are the things that I was concerned about. Those are the issues I had asked to be addressed, and I appreciate the work that got put into this. Thank you.
Councillor Bondi.
Thank you, through you, Mr. Chair. I'm not going to lie and sugarcoat anything, that this is probably the hardest vote I've had in my term on council. It's something I don't think is in our wheelhouse, something that I don't believe is in our mandate. And I'm really grateful for the extra time. And then I believe we're going to have another week of extra time. So I'm so impressed with our staff right now, Mr. Sweet and Ms. Sieben. I think you guys are knocking it out of the park as best as you can with something that, is contentious no matter how you slice it. So I'm so proud of you right now. I think it's great. The educational program for everybody. I think that's something that's going to help everybody, right? Like, I'm happy about that. The timeline, I'm really happy to see that too. I'm really happy to see removing termination. The health benefits I'm going to come back to. I mean, the testing. One thing that I believe Councillor Vanderdolen mentioned is looking at natural immunity. I'm not sure if that's something we can look at, because, you know, I was on this side and now I'm on this side and I'm in the middle. And this is a political nightmare. Let's face it, right? We're all wondering which side of the political spectrum do we want to be on? And we, some of us want to try to stay on the fence as most as we can be. And I think the natural immunity, if we could tie in that, we might get more of a win. So that's one thing. We did hear from town staff on both ends of the spectrum. So I'm grateful for that opportunity for feedback. I still would like to see, because the way it stands, I'm not sure that we are covering any of the costs. And I have done a little bit of work in talking to some other municipalities where they've found kind of ways to look at getting bulk testing for cheaper. Like I have a box, a box of tests from somebody's workplace that I got, and there's 25 tests in a box, and the box was $14. So if I had to pay $14 for 25 tests, that's reasonable. If I had to pay $40 twice a week, that's $80. That's not reasonable. So I would like to see, just seek clarification actually on that, because Councillor Kimber Beek said we found a way around that, and I didn't catch that. Like, can we go over the cost again for the tests, please?
Yeah, through you, Mr. Mayor. So we have contacted the nurse practitioner that the town of Essex employs, and she is able to administer those tests. Unfortunately, she doesn't have the test, so we still would be responsible for providing the test to her. The reason that we want a nurse practitioner or someone trained in order to do those tests is to make sure the tests are valid, to make sure that they're accurate and they're timely, that we're not getting a photo of a test that was done 3 weeks ago. There's a couple agencies where we may be able to get free testing, similar to what you're saying, for small or medium-sized employers. And so that's currently through the Leamington Chamber of Commerce and the Windsor Essex Chamber of Commerce. Once we know whether or not our vaccination policy goes through, then we'd be able to place that order. And then it would be free to employees, or a very low cost to employees.
Okay, further to that, because I do know, like St. Clair College, for example, is providing tests to their employees. There's one employer locally. I do know that some taxpayers are like, I don't want to pay anything for it. But at the same time, the town of Essex has got a lot of grant money through the province for COVID-related costs. And if we have to use this for 3 months to keep good employees that for whatever personal reason they don't want to have a vaccine, I'm okay with that, doing that for the duration of this policy. So great work. Nothing's foolproof. And I think the message that we need to get out there is we do have the best policy in Essex County. We have 7 steps. It's the least cohesive I'm not even saying it right, but it's the least coercion. I don't know. I can't say it right now. We've all been sick at my house right now, but it's the best policy in the county. And so that's something the town of Essex, I think, should be very proud of. Thank you.
Mr. Sweet has a comment on Councillor Bondi's.
Thank you, Deputy Mayor. Just add on to what Ms. Seaman mentioned. So we are looking at no cost to employees. So we are looking at getting the test free. However, if we can't, and as a town, we have to purchase them, our Director of Corporate Services, Kate Darusevich, did come up with that suggestion. We could look at using some COVID money, but I think since we have to report back to council after 3 months, we would know what that total is, and council then could review, we want to continue that, or maybe that cost would be borne by the employee at that time.
So it'll be up for review again in 3 months. Councillor Guerin.
Thank you, Mr. Chair. Yep, very good. Over this past few days, I've been trying to catch up on what's legal, what isn't legal. Do employers have the right to put this on their employees? And from everything I'm seeing, it seems to be a favorable decision that employers can do this. I do like the fact that Councillor Bondi said the COVID relief money, if we can use that. One of the things I was really concerned about was the employees having to pay it and the taxpayer having to pay it. So that might be one way out. The information that there could be some free testing available, even better. I'd still have a little bit of, the termination words out. I still have a little bit of concern with just using the term disciplinary action without letting the person know up front what that disciplinary action may be. Obviously, if they're refusing to get vaccinated and they're refusing to be tested, the disciplinary action is a unpaid leave. Now, with the unpaid leave, though, is there going to be more disciplinary action above that? And how does that affect their actual health benefits with the town, their dental, all that kind of stuff? So looking for an answer on that. And what do we do if we find that this is having an impact on our level of service? That's another concern I have. We have 50% of people that have said that 90% of that 50 is double vax, but the other 50 is a total unknown. We could assume that maybe the double vax maybe didn't want to do that survey, and maybe that's 50-60% of them. So I'm not sure, without knowing how many employees this affects or doesn't affect on a lot of this stuff, but much better policy and than what we've seen last week. So the answers I'm looking for is that broad sentence of disciplinary action. What happens to employees' benefits if they take an unpaid leave? What do we do about how do we monitor the effect it's going to have on level of service? Those are my concerns.
Through you, Mr. Mayor, I can answer part of that question. In terms of health benefits, if someone is on an unpaid leave, they would be responsible for paying the entirety of those benefits.
Okay, so I assume, Brandy, then further that, then that's something that's in their manual anyways, right?
That's correct. That's part of the collective agreement.
Okay, well, we would make them aware at the time they make that decision that would be the case too, correct?
Yeah.
Through you, Deputy Mayor, in terms of your other two questions, in terms of the wording and the policy of up with disciplinary action, for any staff policies, it's kind of that standard line, may include discipline up to termination. So we did adjust that. If it's a union staff, we're always going to have to follow the collective agreement anyways, in terms of the steps would have to follow. If it's a non-union, again, I'm not sure how to come across, and I understand your concern, Councillor Caron. Our intent as administration, we have great staff. We developed a policy with our staff in mind, right? That we didn't want to force anything on them. Something we feel we'd have to do, what's in their best interest. We don't want to lose any staff. So our goal, our intent is not to terminate anybody. We'll do what we can to keep all our staff. But with any policy, I think there has to be some disciplinary comment in there, because you just can't have staff disregard the policy that's going to be approved by council. Your last question on level of service, if the numbers come back where it's a department or it's a certain area, we would definitely come back with council. We would meet as senior administration, come back with a plan or solution and bring that forward to you. But we're hoping with this policy, again, we had staff in mind that we don't get.
Thank you, Mr. Sweet. Councillor Guerin.
Thank you, Mr. Chair. Okay, so further to your point, Mr. Sweet, if the word termination is taken out and we leave in disciplinary action, and I'm not sure what else you could take from them. They're not getting paid, they're not getting benefits, but they can't be terminated. I'm not sure what else we could possibly do. So that's why I know you have to have it in there, but it sounds to me like to just have it in there, I think the steps of disciplinary are already pretty straightforward. I'm not sure what else we could really discipline them on.
You, Deputy Mayor. I want to stress it's not in there just to have it in there. Like COVID, like this pandemic, we don't know what's going to come in a day. So if this lasts for 3 months, 6 months, I think it's just some wording in there to cover us for the future.
Thank you, Mr. Sweet. Councillor Vanderdolen, you had your hand up next.
Thank you, Mr. Chair. Through you, people on both sides of this debate have asked me over the past week, so what do you think is going to happen? And I said, well, I am virtually certain that what's going to happen is they're going to bring policy back to us. They're going to move a bunch of shells around on the board game, but the end result will be exactly the same. And that's what we have here. I mean, I compared last week's policy with this week's policy, and I couldn't find a single word different. Apparently I'm wrong, but it sure looks the same. And I'm still opposed to this for a whole bunch of reasons, from the charter stuff I mentioned last week to simple common sense. You know, I just don't think this makes, it's unfair, it's unsafe, and it's unnecessary. You know, you might say that, oh, the staff are all in favor of it, but maybe the staff are telling me something a little different than they're telling you, because they won't tell their employer to their face that they didn't want to get vaccinated, or they don't want to, or they're going to leave. But I've heard that from people. I mean, this termination thing, you've turned it from termination into not necessarily termination, but termination if necessary. I mean, if the word's still in there, then that's the sword hanging over their head, and we will lose staff because people will leave before we do that to them. I know people. It's, you know, supposedly we're doing the same as the other towns, except the policies of the other towns don't go that far. At least half of them don't. Like 4 do and 4 don't. So we're going to be the town with, ours still seems to be the most harsh. We're going to be the town with the least mercy out of all the local municipal governments. And it's for something that's not even necessary. You know, everything's going to change in the next few weeks and few months. And that's why I think bringing in something so draconian and unfair is crazy, because we don't know what next month, much less next January, is going to be like. Things will change. I mean, in the week since we had our last meeting, a study has come forward from Israel, one of the biggest studies in the world on COVID, 700,000 people who found out that if you've already had COVID and recovered, your protection is 27 times stronger than people who get the vaccination. And yet our 8 to 10 or 12% who've had it and recovered, we're going to make them get the vax anyway. But that's just wrong. And I can't support this. We should be pulling way back. You know, okay, there's some changes over the cost and stuff, but the termination should come out. We shouldn't be saying that. This consensus about the training program, well, I wasn't part of that consensus for sure. I said, no, these things are propaganda sessions. They're horrible. I wouldn't put anyone through it. I think it'd be terrible. Well, I guess I'll have more to say next week when we actually vote. Thanks.
Mr. Sweet.
Deputy Mayor, just a clarification for Councillor Vanderdolen. The report that's in the package you have is the exact same report as last week. What the intent of this meeting is, what do you want us to change to bring forward next week's October 18th? And the things we suggested potentially could change if council approves is remove the termination, add the training, changes in terms of how the testing would occur. So just for some clarification.
Councillor Bowman.
I did have a whole couple of pages here, but I'm going to brief it down. I'm going to support the recommendations that have come forward. I was actually in favor of the original one, but I think these are compromises that we can live with. The education program, the review every 3 months, the removal of the termination word, and the testing. And I realize we're trying to put together a package that gives free testing. I might add that the shot is also free. And but I'll support this because I think it is a compromise, because it has been a very heated discussion on the aspects of this. And as it's been pointed out, both pro and con on both sides. And I think this is kind of coming down the middle, because we have people on one side that are deathly opposed to getting the shot, and we've got people on the other side that are not comfortable working with people that don't have the shot. So I think this is a compromise that we can make sure that we follow what our guideline has to be, is making sure that the workplace that our people are in is a safe environment. So that's why I'll support the recommendations. Thank you.
Councillor Bowman, Councillor Bondi.
Thank you, Mr. Mayor. Or Mr. Chair, since we're still here, is there any appetite with council or administration to look at the natural immunity if someone presents a result from an antibodies test? Is that something we're willing to explore? Is it something we can chart on paper? I think it's a worthwhile discussion. I don't know. I think it's valid. Just seeing what my council colleagues think about that.
Councillor Bowman, you had your hand up first.
I don't think at this point the health units or the province recognizes that portion, whether they will in the future or not. And that's the beauty of this. You can review it in 3 months and make changes. But I don't think that is an option that's open to us right now. Thank you.
Bowman. Councillor Guerin.
And further to that,
I can wait for Councilor Bondi, if that's okay.
well, just follow up to Councillor Bowman's, it's our own policy. It's not mandated. So if it's our own policy, we can write our own policy if we're not mandated by anybody. And I think that would just be another win, exploring the natural immunities. Considering they're not mandating a policy, you know, we could say everybody on Wednesday has to wear green and everybody on Wednesday has to wear green. So just an idea.
Sir Guerin.
Through you, Mr. Chair, it's a question to administration. We've been 20 months plus with COVID right now, and workers working with each other. We must have a situation that's presented itself already of a staff member who refuses to work with a non-vaccinated. What type, if that is the case, if it isn't the case, then I'm not sure what we're talking about here, but if it is the case, and it is a problem, what have we done to make that situation better for both parties? And then I have a follow-up to that.
Through your deputy mayor. In general, we have set procedures, policies in place in terms of PPE that must be worn, social distancing, so that it has not been an issue, because I think your staff have been following those guidelines we set in place.
Follow up.
Okay. Yeah, I'm just trying to identify if there, in these last 20 months, if there's been any issue, people with underlying conditions that work within a room that has one or two more persons in there that may or may not be vaccinated. Are we trying to give them any type of workplace safety now as it is? So that's kind of where I'm concerned. So yeah, I mean, I'm gonna be hard pressed to support anything, I think, regardless of tonight's meeting, that still includes the word termination or includes the phrase disciplinary action without knowing exactly what that action is going to be. And if we can't find a way to get the tests free and we have to force an employee to pay for the test, I'm going to have a hard time supporting it as well. I think we can get past that. I believe with the information we have today, I think we can get there. And I'm hoping that we'll qualify for that. And I'm hoping that we can also use the monies that the government themselves gave to us for COVID relief, which I think this would be perfectly served using that money. So I don't see that being an issue. And I don't think from the calls I've yielded from employees or staff members from the town that they're saying that they don't want to be tested. I think what they're saying is if we're going to be tested, we don't feel we should have to pay for it. And I think if we can get over that hump, the termination word, the disciplinary action, and having it more black and white, I just believe in upfront contracts. Whenever you're doing stuff, whenever you're writing policies, whenever you're hiring somebody, I just believe in that upfront contract. Both parties know exactly what they're facing when they make the decision one way or the other. So that's my final thoughts on it. Thank you. Good job.
Councilor Verbeek?
Thank you, through you, Chair. I'm still not clear for Ms. Stephen or Mr. Sweet. Was there discussion or has the, the proof of the antigen test been considered? I believe that we can, with the doctor's order, get one for $75. And I'm just wondering if that had been discussed when the policy was being drawn up and then reworked, just because it keeps coming up. So I'm just wondering if it was looked into, if there was a reason it was just not included, or if there are valid reasons not to include it as an option.
Can you repeat your question?
Was the test that shows we have the for those that have had the COVID and can prove that they have the antigen, someone give me the word, please, if I'm not saying it right. That test, has that been considered as an option 8? I've heard Councillor Vanderdolen and I've heard Councillor Bondi bringing it up, but I'm not clear if it's ever been even looked at and why it was negated as an option.
Antibody.
Sorry. I have a house full behind me and that's why I got to mute again.
To you, Deputy Mayor. No, as Councillor Bowman mentioned, it's not recognized by provincial chief medical officer. So we're going by what their expertise is, and their recommendation is either vaccination or the rapid antigen test. Even right now, what is mandated to go into a recreation facility, they must still show proof of vaccination. Having proof of antibodies, that's not acceptable right now, according to the provincial government.
Any further comments or questions from council members? Councilor Bondi?
Sorry, Mr. Chair, I'll make it quick. I know that some other workplaces got legal advice, and we haven't gone in camera about this. And so I'm just wondering if that's something, there's people that say if I go to town hall and you don't have a policy and I get COVID, I'm suing you. And then there's, people that'll say if you make me get the vaccine and I get a bad reaction, I'm suing you. So I'm not sure if it's something we need legal advice about. That's my last one, I promise.
Yep, through you, Mr. Mayor, I can speak generally, very generally to that point. Based on everything we've seen and looked at, we do feel there is a risk of legal exposure if we do not, or we're not seen as following the guidelines and recommendations that government authorities, specifically our health authorities, have provided. Certainly, as the employer, we have a legal duty of care to ensure the safest work in place for not only the employees, but as well the visitors to our facilities. There is a concern that if we don't adopt a vaccination policy, we certainly could be seen as falling below that expected or recommended standard of care, which, to your point, Councillor Bondi, through you, Mr. Mayor, might leave us open for someone to suggest that, we're exposing the employees to more risk than necessary or to more risk than best practices would advise. So certainly we have looked at that and considered that in together with the changes that council for this evening.
Okay, so with that said, we are looking for what council wishes to move forward on. The recommendation that's in front of us is that the HR 2021-02 report dealing with the Town of Essex vaccination policy prepared by our HR department be received. And in that regards to the proposed Town of Essex vaccination policy, that this be presented next week. As is, Mr. Sweet.
Through you, Deputy Mayor. Yes, but basically at this meeting, if council is comfortable to give some direction, that we'd come back, revise a policy in the 4 items: the education program, the timelines, the wording on the termination, and how to reduce the cost. So those are the 4 things we presented. If council's in support of us amending the policy with that, would bring that back at the next meeting for final approval. But for tonight, we're looking for direction on those 4 items. If you're comfortable for us to make those changes.
Bjorkman, are you moving? Councillor Bjorkman moves, supported by Councillor Bowman. All in favor? Oh, comment first.
Quick question, the implementation dates, do they have to change as well, or is the present dates okay?
Deputy Mayor, those dates would change based on when the policy, if is approved. So if next Monday, for example, it's approved, we'd backdate those for a couple.
Councillor Vanderdolen, question?
Yes, quickly, through you, I'll support this to see what comes back. Thank you.
So again, I'll ask the question, all in favor of the motion for the changes? And that's unanimous. Thank you. So with that said, I'll say thank you to the viewing audience for being here this evening with us. Thank you to council members for making time this evening for this topic. And at this point in time, I'll ask for adjournment. Motion for adjournment, Councillor Guerin and Councillor Vanderdolen. All in favor? Carried unanimously. Thank you. Have a good evening.